I'm Dr. Chaitali Bhatt, Assistant Professor, Parul Institute of Physiotherapy. Welcome our respected speaker, Dr. Neepa Shah ma'am, respected faculties, and all dear students on the live webinar session on the topic Breast Cancer Rehabilitation. As we all know, October month is celebrated as Breast Cancer Awareness Month, and rehabilitation during and after breast cancer treatment can reduce the treatment side effects and enhance its speedy recovery. So, Parul Institute of Physiotherapy have organized a webinar on breast cancer rehabilitation by our speaker, Dr. Neepa Shah. Before proceeding further with the today's webinar session, I would like to introduce our speaker, Dr. Neepa Shah ma'am. She has completed her master's in orthopedic physiotherapy from Ahmedabad, and currently she is working as a lecturer and practicing in orthopedic department of SBB College of Physiotherapy in PS Hospital, Ahmedabad. She has having 15 years of academic experience. She is a certified lymphedema therapist from Academy of Lymphatic Studies, ACOLS, USA, and she has successfully treated more than 50 patients of lymphedema in last 2 years. She is also a certified Maitland and Mulligan practitioner, certified neurodynamics practitioner, and certified aerobic fitness trainer. She also has contributed in research works. I welcome you, ma'am, on behalf of PIPT. Over to you, ma'am.
Thank you very much, Chaitali, for a very nice introduction. Thank you very much, Parul University, Bhavna ma'am, for giving me this great opportunity to talk about breast cancer rehabilitation in the month of breast cancer awareness. So that is celebrated all over the world by different activities for raising awareness about the breast cancer. And I am grateful. So today I'm going to talk about the rehabilitation physiotherapy after the breast cancer and its related treatment. Am I audible properly, Chaitali? Should I start?
Yes, ma'am.
Okay. Here you can see two faces. One is happy, one is sad. One is happy because they have fought against the cancer. The life is saved. So they are warrior. They are happy. Life is saved. But that's not enough. If your life is useless, if it is miserable, if it is not functioning properly, then the person cannot do all the ADL activity properly. So that quality of life of the person that is affected. So you can see that next phase that is said. So they are warrior, right? So in that, because the cancer survival rate is increased 50%. In modern era, we know that the number of the cases are increasing, right? Together with that, the advancement of the technology is also increasing. So survival rate is increasing, the death ratio is reduces. So life is saved, but what about the quality of the life? So fight is going on against the cancer survivor, right? But now the thrust in cancer care is not simply on the survival, but that is on the quality of life of the survivor. So for this quality of life, we as a physiotherapist can work a lot. So now I will start my topic about the cancer rehabilitation. One by one, I will talk how the rehabilitation can work in different stages of the cancer. So we can start our rehab even after the diagnosis of the cancer, pre-surgical phase, post-surgical phase, even during chemotherapy, during radiotherapy, and later on in every stage, the physiotherapy has a different role. Cancer rehabilitation, that is defined as a process which assists the cancer patient to obtain the maximum functioning by focusing on 6 areas. So our role to get the maximum function, and we can focus on the not only physical, emotional, but also psychological, social, vocational, and spiritual. So we need to focus on all these 6 areas that will ultimately improving the quality of life of the patient. These all are our rehabilitation aims, how we can work in a different issues. So first of all, restorative care. Restorative, our aim is to return the individual to pre-morbid function with a minimum of functional impairment. So patient can perform all the pre-morbid function with less impairment. Our second aim, that is supportive. We need to support for the functional difficulties. We need to reduce all the difficulties and compensate for the permanent deficits. Third aim is the palliative treatment. It's very, very, very important because palliative treatment usually always for the last stage of the cancer patient. So terminal stage, the physiotherapy role is a great, that is a vast role. We need to work to eliminate or to reduces the all complication, especially pain. So in palliative treatment, in palliative stage, our role is to reduce the patient's complaint. In Ahmedabad, we have a different palliative care, the palliative care centers, where the whole team is working, including physiotherapy, for the terminal stage cancer patients. The next is preventive rehabilitation. It has another new advanced terminology is prehabilitation. Nowadays, we know that prevention is always better than cure. So we need to work after the breast cancer, during the women's treatment. We need to work to reduce all complications. Basically what happened, we are giving treatment after the development of all problem, the development of the restriction of the range of motion, development of the weakness, development of the lymphedema. But if we work prior the development of all complication, right? So we need to educate the patients regarding the importance of the exercises, what are the do's and don'ts, how to prevent all these complications, which are the factors which are triggering all the complications. So these all knowledges are very important for the prevention of all these complications. The cancer rehabilitation program, often we are doing the different programs, different exercises, our all protocols, definitely they will improve the overall function of the patient, that is reduces the pain, improve the well-being and help the patient, that is our ultimate aim, that help the patient return to activities of daily living. Before starting our rehabilitation, we need to give assessment. Generally, we are doing evaluation before starting our any treatment. So the same thing is required here also. So we can start we can do all this assessment and management in a pre-surgical state. So chest examination, the routine chest examination, the auscultation, whether the chest is clear or not. I'm not going to detail in this chest examination, but that is again an important part before proceeding the treatment. Examination of the surgical site, the scar, whether it is healed properly or not, if infected, the adherent or non-adherent, surgical related, if the patient is having pain related to the scar. So all this examination is needed before starting any shoulder range of motion exercises. Pain examination, detailed pain examinations regarding the site of the pain, regarding the intensity of the pain. Why am I talking about site and intensity? Because a cancer patient may have pain related to the surgical site, or it may related to the neuropathic pain. So it's also very common after the surgery. So you need to identify whether it is neuropathic pain or just post-surgical pain. Sometimes patient may have the generalized body pain and malaise. So you need to identify this pain, the intensity, the criteria, whether it is related to the localized area or it is generalized malaise, pain and fatigue. So after the examination, we can treat accordingly. We need to evaluate the posture. Why the posture? Because breast cancer, after the breast cancer surgery, the patient is having scar on the chest. Because of this scar, because of this apprehension, pain, stress, anxiety, the patient assumes the posture, that is the protracted shoulder posture, together with the forward head, kyphotic. So this is the common posture which is identified in the patient after the uh, post-surgical breast cancer, right? So we need to evaluate it properly before the treatment. And then basic cover what we are doing, that evaluation of the range of motion and strength. And the most important another point, additional point, that is the lymphedema evaluation. The lymphedema evaluation, that is, you can do pre-operative also. We need to explain the patient about the lymphedema, what is lymphedema, that is the major complication after the breast cancer surgery. Okay, so you need to explain how the limb will be swollen because the lymph nodes are removed. And for that, patient need to understand the symptoms, the initial early symptoms of the lymphedema. So for that, how will you evaluate? Then for that, we need to go for the circumferential measurement. We need to go for the different level of circumferential measurement by the measure tab. So prior baseline evaluation is, we need to make it ready. So patient can identify whether that measurement is increased or not. So these all are the common problem list after the breast cancer or after the surgery, during chemo and during radio. These all are very painful different stages in women's life, right? So one by one, I will discuss about the different complaints and how we can reduce this, how we can help the patient to cope up with all these problems. Chaitali, all good? Can I go ahead?
Yes, ma'am.
Okay. So first of all, pain. Yes. As I told you that pain may be surgical and may be neuropathic. So best options that we know, that is medicines. It's a mainstay for this pain after the surgery. Basically, after the breast cancer, patient may have the pain at the scar area, at the shoulder joint, and sometimes the whole upper limb may be painful, right? So what else we can do rather than simple medicines? Yeah, patient is taking medicines. 1 second. Sorry for the disruptions, my battery is low. Okay. Uh, so if the patient is taking medicine, still the patient is having pain in the whole upper limb. Sometimes the whole body is giving pain to the patient. So at that time, we can give the therapeutic application of the cold. You keep in mind, it is very important, any heat modalities are strictly contraindicated in patient is after the breast cancer. Why it is contraindicated? Because that will trigger the development of the lymphedema. That will develop the development of the trigger the development of the swelling of the upper limb. So for that, never use any heat modality in the breast cancer patient. Clear? But yes, we can use the cold. We can use the cold for the smaller period of time, for the 5 minutes, for the 4 or 5 minutes, not more than that. Other than what we can do is relaxation, because all this pain is related to the stress, anxiety, the muscle spasm. Okay, so at that time we can give the different relaxation technique by giving positioning. Generally, I told that patient assumes the position of the protracted shoulder, so we need to correct the posture. And the most important is we need to teach the diaphragmatic breathing exercises. Why? Because patient will use the extra accessory muscles of the respiration rather using diaphragm. So for that, we need to give the proper position, what we are giving for relaxation, half line position, proper breathing exercises, proper position of the shoulder. In that, the muscle is relaxed. So all these small things that will reduces the pain of the patient. You can also give the manual lymphatic drainage technique, because that not only reduces the swelling, but that will also give the soothing effects, that will contract the smooth muscles in the lymphatic vessels, and that will reduces the pain. So these all we can use to reduce the pain in a different stage of the breast cancer treatment. Now about the electrical modalities. Can we use electrical modalities in cancer pain? The evidence says the acupuncture and TENS, both as an analgesic methods for cancer patients, they are used, but they are not supported by the data currently available from the majority of the clinical trials. Okay, so the many people are using the TANs for the pain in a cancer patients. Acupuncturists are also using, some uses laser also, but no data they are available. They are supporting that they will reduce this pain or not. So I prefer only the different relaxation exercises, and believe all these techniques work. That will reduces the pain together with the manual lymphatic drainage. If the patient doesn't have any lymphedema, still if you give the manual lymphatic drainage techniques together with the different relaxation, different breathing exercises, with the proper posture advices, and with the eyes, this all together can reduces the pain of the patient, pain related to the shoulder, pain related to the scar, or the whole body on the whole upper limb pain is reduced by giving all these techniques together. Yeah, it is not supported, right? Now, chemotherapy. That we know chemotherapy can destroy the cancer cells. But together with cancer cells, it also affects our healthy, normal cells. So many multiple side effects are there of the chemotherapy, like nausea, vomiting, fatigue, pain, susceptibility to infections, decreased in the blood cell count, mouth ulcer, sores. So these all are the side effects. So how as the physiotherapist can help in all these side effects? So exercise training, particularly the aerobic training. So aerobic training, the research also has supported that aerobic training that increases the total hemoglobin and the red cell mass, which enhances the oxygen carrying capacity. So ultimately that will reduces the pain of the patient, that will reduces the fatigue, malaise, anxiety, stress, and that can improve the overall immunity, that will boost up the immunity of the patients. So definitely it is a myth, if the patient is on the chemotherapy, it is myth, the patient is having chemotherapy, don't give any exercises, but it's not there. Still on chemotherapy, if the patient is doing exercises for mobility exercises, aerobic training, or any other symptoms related training, that will definitely reduces all these side effects. Now radiotherapy. Radiotherapy basically works on the tissues, right? We know that radiotherapy is also for the cancer cells, but with this cancer cell therapy, they also work on the tissue elasticity. They will do the loss of elasticity, vascularity, and the moistures. Tissue thickening and contractures, chest wall adhesions, soft tissue fibrosis, those all are the common side effects after the radiation therapy. And these all are really painful to the patients and the development of the lymphedema. So what we can do in that stage, the most important is during radiation therapy, the patient should perform all the shoulder girdle flexibility exercise. Otherwise, that will develop the fibrosis and patient will not able to go for the full shoulder range of motion exercises. So maintenance of the shoulder range of motion exercises is very important if the patient during the radiation therapy. In that, what happened if the patient is taking radiation therapy, the whole skin will burn. The patient will again they have a pain and they will not do any exercises on any shoulder range of motion exercises. So that will develop further more and more fibrosis, contractures, and the reduction of the range of motion. So to prevent this complication, we need to do the shoulder range of motion exercises, flexibility or stretching exercises, the scapular strengthening exercises, the pectoralis major and minor stretching. But that stretching, it should be very gradual with very low intensity, right? So these all are the exercises is very important. Again, I am repeating simple shoulder range of motion exercises. Shoulder will go to the full range of motion for all flexion, abduction, and particularly rotations, right? Together with the scapular strengthening and scapular stabilization exercises. Because we know that if the stability is not there, shoulder will not move. Because all this posture, patient, because of this protracted posture, the retractors will be weak. And if the retractors, the scapular stabilizers are not working properly, patient will not able to raise her limb. So that's why we need to focus even during radiation therapy, patient should perform all shoulder and scapular stabilizers as well as flexibility exercises. Together with that, the different creams, the moisturizing creams that is always prescribed by the doctors, physicians. So patient need to apply in the all area after the radiation therapy, even on the whole upper limb. Yes, patient can do the manual, we can do the manual lymphatic drainage and the aerobic conditioning. The prescription of the aerobic condition, I will later on I will discuss about all the according to the FIT principles how we can go for the aerobic training. Another major problem after the cancer and cancer related treatment, chemo, radio, in all the things, the major problem, the major symptoms of the patient is fatigue, and that is terminalized as a cancer related fatigue. Cancer-related fatigue, that is distressing, persistent and subjective sense of physical, emotional and the cognitive tiredness or exhaustion related to cancer that is not proportional to the recent activity. So patient will feel about the fatigue. So as said, it is not related to the activity and that is persistent by 30 to 70 percentage of the patient, and that is very prevalent in the during the chemo and the radiotherapy. Yes, in these symptoms, because if the patient will have pain and fatigue, that is always related to the reduced activity level. And if the activity level is reduced, again, that is related to the multiple complications. So how we can work on that? The fatigue, burdens. So cancer-related fatigue, that will, as I told, it will give impact on the physical functioning and ADLs, and ultimately that will affect the quality of life of the patients. Because if the patient is not doing activity during these different stages of cancer treatment, that patient's ability to perform the activity will reduce, and that will affect the quality of life in later on, after finishing all this chemo and radio, the patient's activity and the quality of life both are affected. So how we can work on the fatigue and deconditioning? So first of all, if the patient feels fatigue, what we can do is we can give the different energy conservation techniques. Energy conservation techniques, how we can ask the patient, first of all, if the patient feels fatigue, we need to schedule the rest. We ask the patient to go for rest before patient become fatigued, and together with the frequent short rest that can help in between the activity of the patients, or even in between the exercises, or even in between the physiotherapy. If we are going for these exercises, in between the frequent rest, they are necessary to continue the exercises further. Proper body mechanics, as I told that if the posture is wrong, if the the accessory respiratory muscles are used, the energy, we need to conserve this energy by making the proper body mechanics, by correcting the posture, by correcting the imbalance between the muscles, which is giving wrong posture, particularly the scapular, the pectoralis and the retractors. Same, if the patient is having forward head posture, we need to stretch the suboccipital muscles and we need to strengthen the deep cervical neck flexors. So these all are the muscular imbalance. If they are corrected, that will also conserve the energy and patient can utilize it in a different exercises. Prioritize the activities and organize the work of the patient. Okay, so decide which activities are important and ask the patient to use the energy on the important task. So these all are the advices and which are very important. So then and then patient can continue the different aerobic exercises. So rest, schedule rest by using the proper body mechanics, organization of the work. These all are important to control the fatigue. Rather than energy this is all about the conservation techniques, right? We need to ask the patient to go for some aerobic exercise program that should be supervised. Rest and sleep pattern, stress management, and the nutritional management. Nutritional management, multiple fluid intake, that is very important even during exercise, that we need to take care. If we are asking the patient, if the patient is doing, we need to take care the in between frequent rest is required, and in between that frequent fluid intake is also required during our physiotherapy. So that will help and patient can again continue the exercises for the longer period of time. Now we will talk about the exercises and the fatigue, the cancer fatigue. As I told that fatigue, inability to do work, inactivity, stress, anxiety. So these all are very disabled symptoms in cancer patients' life. Particularly women is having breast cancer surgery, after that, after chemotherapy, after radiotherapy, activity level will reduce, right? So we can boost up the activity level, we can reduces the fatigue, we can reduces the pain, we can boost up the immunity of the patient, which is very necessary after the cancer, the boosting up the immunity system. So this all we can achieve by giving the exercises, particularly aerobic exercises. So initially, patient will not able to perform all these our routine aerobic training like treadmill training, cycling, swimming. So initially, patient will not do. So we can start with the arm ergometry. Okay, so with simple, in the breast cancer, patient is having weakness in the shoulder muscles. Patient may have the tightness of the scapular muscles. So better to start with the arm ergometer. In that also, we need to schedule the exercise, rest, exercise, rest. Okay, so also they have a different protocol in the research. So we can start with the 1 minute of ergometry, then you give 1 minute of rest. Then you increase your work period, give 2 minutes of exercises, give 1 minute of rest. Give 3 minutes of exercises, give 1 minute of rest. So in this way, progressive exercises with in between rest, that is very important for this kind of patients. So we should start with this arm ergometry, then the chair-based chair aerobic exercises, because initially patient doesn't have that ability to perform all these treadmill, cycling, walking, swimming, all these exercises. So better you should start with these low impact exercises. So we should start with the arm ergometer, we should start with the chair aerobic exercises or the simple walking. Ask the patient to walk for 5 minutes, and again, not for the continuous, 5 minutes in the morning and 5 minutes in the evening. So you can start like that, and then patient can continue. We can increase the time of the exercises. After that, patient can able to go for the treadmill training, cycling and swimming. So this is all about the aerobic exercises, very important. Together with another important exercises are flexibility and stretching exercise. As I told that after the breast cancer surgery, chances of restriction of the range of motion in the shoulder, that is very high, right? Together with the tightness of the scapular muscles, weakness of the scapular muscles. So we need to give the stretching exercises, stretching of the pectoralis, major or minor, right? Stretching of the triceps, stretchings of the long finger flexors and long finger extensors. So these all are and the stretching of whole shoulder in a flexion and abduction, right? So these all are the simple basic exercises. So you need to put the each and every joint in full range of motion, right? So full range of motion, that is the basic need to perform the further rehabilitation. So we need to go for the simple flexibility exercises for the shoulder, for the elbow and for the wrist, that is long finger flexors and extensors. Yes, now turn is about the resisted exercises. Progressively, if the patient is doing aerobic exercises, if the patient is doing the simple flexibility exercises, we are putting the shoulder in full range of motion, we are stretching the other muscles, we are keeping the scapula in a proper position. After that, that comes with the resisted exercises. Resisted exercises, we need to strengthen the shoulder and scapular muscles, right? So strengthening that we are giving either by dumbbell, either by weight cuff, even the manual, whatever means you can use, you need to strengthen all the shoulder and the scapular muscles, right? Together with advanced training, you can go with the Pilates on the vestibular ball, you can go with the TheraBand training. So the balance and the strength both are increased by using all these different advanced techniques. Yoga is again very, very, very important, not only for the flexibility, but also it improves the emotional status that is disturbed, that we know. It improves the emotional status, again it improves the immunity status and overall flexibility strength. So every aspect is covered by the different yoga. So that is a very vast topic again, the yoga for the breast cancer patients. There are different yogas are there, particularly for the breast cancer patients. Okay, so that will focus more on the shoulder, upper body, chest, right? And the different hand grips and hand muscles. So now we are talking about the Acsm guideline for the aerobic exercises after the breast cancer patients. We can advise your patients to engage in exercises recommended by the American Cancer Society and the American College of Sports Medicine. We are using these protocols, right? So if we are giving aerobic exercises, generally we can go for the 150 minutes per week, moderate intensity. Moderate intensity, according to the FIT principle, we should not go beyond RPE 11 to 30, and that should be spreaded over 3 to 5 days per week. So this is a simple dose of the aerobic exercises after the breast cancer or related treatment. So patient can go for the 150 minutes. So that is the whole week program. But the RPE, it should be maintained between 11 to 30. And it is very important that this aerobic exercise training program, it should be supervised properly, right? The patient should be examined properly, it should be advised properly and supervised properly by the certified therapist, so the complications will not arise. If we are talking about the resistance training, so it should be at least 2 days per week. 2 days per week, that is recommended for 8 to 10 major group of muscles and 8 to 10 repetitions per 2 sets. These all are research based numbers, so definitely we can go according to this protocol. As I told that it should be supervised, and also this all exercise protocol, it should be tailored to pre-treatment aerobic fitness testing and exercise tolerance, right? Safely progress exercise program to avoid the injury. And that we know any aerobic exercise require warm-up and cool-down, so same is here. So each session should include proper warm-up, proper cool-down to prevent the DOMS. See, these all are the research. Effects of aerobic and resisted exercises on physical symptoms in cancer patients. So they concluded that exercise intervention was confirmed to improve the fatigue. As I told, the major problem is pain, fatigue, rather than restriction of the range of motion and the weakness. The major is this restriction, weakness in the shoulder group of muscles. This starts with this problem, that is fatigue and pain. If we deal with these initial symptoms, then the further complications may be reduced. So fatigue, pain, insomnia, that might have reduced the dyspnea in the cancer patient. Okay. Yes. Another problem is immobility. Immobility, restriction in the range of motion. So that is, we can continue with the different active and active assisted shoulder range of motion exercises, as I have discussed earlier. So all shoulder range of motion exercises, flexion, abduction, flexibility exercises, and typical rotation. So we need to give the different activities, as that is seen in the picture, that the towel exercises, the different activity we need to advise the patient, that patient can continue at home, the stick exercise, the towel exercises, just to maintain the full range of motion in the shoulder. So this is the cancer related breast. After the breast cancer, patient can go for the gradual stretching exercises that should be active. It can be passive, it can be with the different instrument. So tricep stretching, the capsular stretching, yes, the latissimus stretching, the long finger flexor and extensor stretching. These all are required to maintain the full range of motion at the shoulder joint. Now another and the major complication after the breast cancer, that is the lymphedema of upper limb. You can see in this pic how the limb is swollen. So we will discuss about the lymphedema. in brief, that axillary lymph nodes after the breast cancer surgery, in surgery, they remove the breast, together with that they also remove the lymph nodes, right? So some lymph nodes are removed and some are damaged more after the radiotherapy. So lymph vessels are blocked. The circulation of the lymphatic fluid that be affected, that will block the lymphatic flow. And when the lymphatic fluid is collected into the hands, when the lymphatic vessels are blocked, the lymphatic flow is that is affected. What will happen? The fluid is collected in the whole upper limb. That will collected in the fingers, in the arm, in the forearm, even in a chest, or even in the back area, upper back, scapular area. The fluid will be collected, and that is known as lymphedema. So blockage in your lymphatic system, that will build up the fluid, and that swelling is known as lymphedema. So what are the goals of this system, lymphedema management? That is reduction of swelling. So how can we reduce the swelling? By utilizing the healthy lymph vessels, by utilizing the healthy pathways, by bypassing all these fluids to the healthy area. And after removing that fluid, after giving the correct pathway to the fluid, we need to maintain that reduction. We need to prevent the reaccumulation of the fluid. So these two important goal is required for the treatment of the lymphedema. And for that, gold standard recommended management is there, and that technique is known as a CDT, complete decongestive therapy, by the Warder, Mr. Warder. So it's also called it as a Warder technique. I tell you that complete decongestive therapy is not a complete cure for the lymphedema. It is a management that can control the symptoms. That can control the symptoms, and that can improve the quality of life of the patients. But as I told earlier, if we work before the development of the lymphedema in the preventive measures, if we ask the patient to do the self-management, the self-lymphatic massage, self-manual lymphatic drainage, so that will not develop. So this is the treatment for the developed case of the lymphedema, and also we can work in a preventive measure. So these all are the study that will shows that CDT decreases the limb volume and improve the overall quality of life of the patient. There are 5 components of CDT. First is simple education and skin care. We need to advise the patient what to do, what not to do. I will take one by one in detail. The manual lymphatic drainage. After that, the compression therapy, and with this compression therapy, patient will do exercises. The first component that is very important, that is the manual lymphatic drainage. It is a very gentle manual treatment. What we call it as a superficial effleurage. And the different techniques are that, but these all are very superficial. We need to drain, or we need to reroute the lymphatic flow from affected side to the unaffected side by the different manual technique. By giving the manual technique, we will improve the activity of the lymphatic systems, and we will reroute the flow from the blocked area to the healthy area. It is a very skillful technique, requires skill, practice, and proper education and proper certification. So it's not a traditional massage that you can see in this, but it is a very superficial. Why it is superficial? Because our lymphatic system that is situated just beneath the epidermis. So it's very superficial in our body. So if we are giving deep massage, deep effleurage, if we are giving electrical stimulation and compression and deep massage, so that will affect the circulation more and more. So it is a very advanced technique, skillful technique according to the pathway of the lymphatic systems we are working. So it requires detailed knowledge of the lymphatic system, the lymphatic vessels, where they are going, how they are diverting, and how they supplies. So the MLD strokes are very gentle, as I told it, because our system is superficial. It has 2 phases, and it should be repeated 5 to 7 times in the same area. After giving manual lymphatic drainage, after transporting all the fluid from the affected side to the normal side. For example, in the breast cancer patient, if the patient's axillary lymph nodes are removed, I will transfer all the fluid from the affected side to the normal opposite side of the axillary lymph nodes and to the contralateral axillary lymph nodes and the ipsilateral inguinal lymph nodes. So I have 2 pathways. Either I can drain towards the normal axillary lymph nodes, or I can drain the fluids towards the normal ipsilateral inguinal lymph nodes. Okay, so for that it's a very skillful technique, require at least 30 to 45 minutes, and after finishing that I need to give compression for for preventing the reaccumulation. So always the risk of reaccumulation after the decongestion. So to prevent the reaccumulation, to improve the efficiency of the muscles and the muscle pumps, and to provide the supports for the tissue which have lost elasticity, we require compression. Now we have 2 types of compression. In phase 1, I will tell you later on what is phase 1 and what is phase 2. So in phase 1, when the patients are coming to us, regular I am giving MLD. Regular, after the finishing my MLD, I will give the short stretch bandages. So you can see that it is a multi-layer bandages, right? That this is not typical what we are giving in a elastocrap bandages. It is the whole lymphedema kit is different, that contain the different size of bandages with the foam roller. So with the foam, first of all we need to apply the stockinets, then foam, and then these short stretch bandages. So it is a multi-layer bandages I need to apply after finishing MLD. And if in phase 2, if the after the finishing of the treatment, patient can continue all the treatment at home by wearing these compression garments. Simple stockings. Patient can wear it and maintain it at home. So as I told, the phase 1, that is the treatment phase, the patients every day coming to the therapist. Therapist will give manual lymphatic drainage followed by compression bandaging. After the bandaging, patient will do the different decongestive exercises, that is shoulder, range of motion, shoulder, and the elbow and wrist strengthening exercises. After phase 2, when the swelling has been reduced, swelling is reduced, then the phase 2 start, and that is the maintenance phase. So patient wears compression garments during the day. At night may require bandages. Together with the skin care, daily exercises, and patient can do the self-manual lymphatic drainage at regularly at home. Decongestive exercises, as I told, it's a simple active stretching, strengthening exercises. That is very important. That will increases the muscle pumping, increases the lymph vessel activities, lymph transportation, and that will increases the venous and the lymphatic return. Okay, so only manual lymphatic drainage is not sufficient. After that, patient need to bandage, and with bandaging, patient need to do all these exercises. So all will help together for the reduction of the swelling. Together that the breathing exercises, very, very, very important after the breast cancer. So we need to teach in these exercises in each and every phases of the treatment. It's very helpful for all the problems. So we need to teach the diaphragmatic exercises. From earlier, I am focusing about the diaphragmatic exercises that will relax the accessory muscles, and that will also help for the lymphatic flow. It will improve the lymphatic flow because our thoracic duct, the largest lymphatic trunk, that pierces the diaphragma, and then that will drain into the supraclavicular fossa in the venous angle. So if the patient is doing diaphragmatic breathing, that will also transport the lymphatic flow. So this diaphragmatic breathing exercises that is helpful for all the problems, for fatigue, for stress, for even for the lymphedema. So ask the patient to do all exercises regularly. Together with that, patient can go for all the aerobic exercises, resisted exercises. I want to tell you one thing, that after the breast cancer, there is a myth. This is always told by the many people, even in a society. Sometimes I don't know, but it is a myth. Patient cannot able to use the limb, upper limb particularly. Okay, exercises are not safe. You need to take care. These all are the advices from the society. You need to take care about your limb. You will not lift the weight. But these all are the myth. Patient can do all the exercises. Patient can lift the load. Patient can even go for the weightlifting, water exercises, resisted training, and for all that researches are available. Okay, so we need to advise the patient to maximum use of the upper limb, right? So that will not increase all the problems, but definitely that will reduces all the problems. I told that is the fourth component is the skin and nail care. Uh, After the breast cancer surgery, the lymph nodes, axillary lymph nodes are removed, and lymph nodes and the lymphatic system that equal for the immunity. And if that part is removed, the patient's immunity is reduced, and that is susceptible for the infection. So chances of the upper limb cellulitis, that is 10 to 20 times more in the affected area, right? So the risk is there for the infection. So to reduce the risk of the infection, we need to give all these proper instruction after the breast cancer surgery. And it is very, very, very important, because patients are not doing all these things, and that will develop the complications. We ask the patient to eliminate the bacterial and fungal infections by using the medicated powder, hydrocortisone cream, and ask the patient to bathe daily. We can ask the patient to reduce the risk infections by avoiding injury, mosquito bite, itching, and ask the patient to use the low pH lotion. Cleaning all injuries are very necessary, and consult whenever the injury occurs immediately. So these all our instructions are very important. We need to advise the patient that chances of infections are more in this limb. So better take care. Apply the moisturizing cream. Why? For the prevention of the dryness, the scaliness that will break the skin. So to prevent this, we need to ask the patient after the surgery, we need to ask the patient to moisturize the upper limb skin 3 to 4 times a day. It is very important. Other than that, avoid the heat. We ask the patient, we need to give advice, proper advice, that avoid the heat, avoid sauna bath. What happens if the patient is having stress, pain? The patient will go for the sauna bath, patient will go for the massage. So prior that, we need to give advice. So these all are the strictly contraindicated for the prevention of the complications. So ask the patient to avoid the heat, the hot packs. Generally the patients are taking. I am telling because I have treated many patients of the breast cancer, and these all are come from the history of the patient. Whenever I am asking the development of the lymphedema, because development of the lymphedema may occur after the 2 years, after the 5 years, after maybe after the 10 years. And if you ask in the history, the triggering factors may be heat, triggering factors may be injuries, tight clothes, jewelry. So we need to give advice prior to prevent this complication, right? So we ask the patient, avoid heat, avoid mosquito bites and injuries, no tight clothes, jewelry, no vena puncture. It's very important. No vena puncture on the affected extremity. If the patient is having right breast cancer, then no injections or the prickling of the skin on that affected upper limb. Okay. No BP measurement on the affected limb. These are very important instructions. If the patients are not following all these instructions, then that may develop the different complications. And particularly the swelling, the lymphedema of the upper limb, the fibrosis, and all other complications. Travel in the air may trigger the development of the lymphedema. So in that cases, if the patient is traveling, they need to do the gripping exercises, pumping exercises continuously in the air, right? Nutrition again is a very important. High calorie diet, low fat diet with the multiple vitamins and the multiple fluid. Okay, so these all are the research suggesting how the quality of life is improved by giving all this lymphedema management. So you can, I just discussing the different cases. You can see this, the pre-treatment limb and the post-treatment limb, and you can see the results. So this is a very effective gold standard treatment for the swollen limb. So this is the truncal lymphedema. As I told, the swelling is not only developed in the upper limb, it also developed in the upper back. It also developed in the chest area. Okay. You can see that ladies that is operated in 2012, but the lymphedema developed after the 2 years, right? So she is living with this heavy swollen limb, but then after I have treated in 2019 and still it is maintaining, she is maintaining at home by doing all this self-manual lymphatic drainage technique. Okay, so these all are the my cases I have discussed. I have treated many cases of lymphedema. I have treated many cases of the breast cancers with the diagnosis after the surgery, even during chemotherapy. It's very important if the patient is taking proper rehabilitation in each and every stages of life, right? Who are at risk for the lymphedema or have the lymphedema, they also can have the excellent quality of life. So same thing, who are at risk of the breast cancer, who are having the breast cancer, they should have the excellent quality of life. And we can play a great role to improve the quality of life. Thank you very much. Any questions?
Uh, no, ma'am. That was a very nice lecture by you. Can you just stop sharing, ma'am?
Yes.
So thank you so much for sharing the very informative session on breast cancer rehabilitation. You have very thoroughly and very briefly and detailed covered all the parts, that is complications of the breast after breast cancer, even during breast cancer treatment, incorporating all the recent advances.
Yeah.
And
It is
also
very necessary because nowadays we are doing recent
evidence,
what we call it as
evidence-based
a
practice, evidence-based
evidence based practice,
practice.
right?
So yes, it is very informative for on the part of the evidence-based practice, and also you talked about the waters technique, that is complete decongestive technique, CDT, and it's all 5 components. And at the end, you have very practically shown your cases, how you have treated all the patients of breast cancers.
Yeah, very
I
little, very time is short, and just I have briefed all the techniques and protocols. But it is a very vast area that we can work definitely for the breast cancer patients.
Yes, ma'am. So thank you so much for being with us on this platform of webinar session. And I really thank you on behalf of Parul Institute of Physiotherapy, Parul University. So thank you, ma'am.
Okay, welcome. Thank you for giving this opportunity. Uh,
Thank you, ma'am.
Goodbye.
Goodbye, ma'am. So,